Every 40 seconds, someone in the United States has a stroke. And the most frightening part is that many people miss the earliest warnings because they look subtle or they come and go. And when we miss them, the brain pays a massive price every single minute that passes. So today I'm going to give you 8 red flags you must never ignore. Show you quick self-checks you can do in the moment and explain what is happening inside the brain so you know exactly why speed saves lives. A stroke is like a traffic jam inside the brain's highways. In an ischemic stroke, a clot blocks blood flow, so oxygen-rich blood cannot reach the brain cells, while in a hemorrhagic stroke, the vessels actually burst and bleeding itself crushes and stars nearby tissue, and in both cases, the clot is brutal. Every minute without oxygen destroys about 2 million brain cells. So you must act immediately and never wait to see if it passes. And here are 8 warning signs to know by heart. Number 1, a crooked smile or facial droop. If you notice that you ask someone to smile and one side hangs different than the other, treat it as if it is a stroke until proven otherwise. Number 2, weakness in the arms or numbness on one side. Have them raise both arms, and if one drifts down, that's a red flag. Number 3, sudden speech trouble. Ask them to repeat a simple sentence, and if it doesn't come out the right way and it comes out slurred, garbled, or confused, you must act. Number 4, sudden change in vision like blurriness, double vision, or gray curtain. Number 5, sudden loss of balance or coordination. When the room spins or the legs give out, it could be a posterior circulation stroke. And number 6, a thunderclap headache, the worst headache of your life that explodes without warning and can signal bleeding in the brain. And number 7, sudden confusion or trouble understanding when they are present but they're lost. And number 8, a brief episode of these same symptoms that quickly resolves, which is not a relief but a transient ischemic attack, a warning stroke that often precedes the major event. Use the word FAST, F-A-S-T, to lock this in: face, arm, speech, time, to call 911, and expand it to be fast by adding balance and eyes, because many dangerous strokes begin with dizziness or visual loss. Right now, you can test yourself. Smile in the mirror, raise both arms, speak a sentence, check your vision, and notice your balance. Because if any of these are off, you cannot waste a second. Inside the brain, there are 2 zones when a clot blocks an artery: the dead core that is already lost, and the penumbra, which is tissue that is suffocating but still is salvageable if we restore blood quickly enough. And that is why emergency teams use clot-busting medicines or even thread devices to the brain, into the brain, to pull a clot out, but only if we act in time, which is why the exact moment of symptoms, when it begins, it's critical. While waiting for help, do not try to fix things at home. Do not drive yourself. Do not swallow aspirin on your own, because some strokes are bleeds. And do not try to lower blood pressure, because the brain under stress has unique needs. Instead, call 911, unlock the door, gather medications, and let the paramedics prepare the hospital team while you are on the way. To prevent these events, long before they happen, you must control blood pressure, sugar, cholesterol, and weight. You want to stop smoking, exercise daily, hydrate, sleep well, and manage stress. But prevention only works before the event. Once the warning sign appears, every second matters. Remember, be fast. Balance, eyes, face, arm, speech, time, because the brain only gets one chance. And if you or someone you love has even one of these red flags, you must act immediately because your decision to recognize it and call for help can save a brain, a voice, a memory, and a future. Please share this with someone you care about because these 8 silent red flags could save their life. So I hope this video was informative for you because you never know, you just may save a life. Please share this with your friends and family, leave your comments below, and most important, make it a great day. I'm Dr. Alan Mandel.